listening to the Pharmacist Answers podcast. I'm Cynthia, the pharmacist, and today you'll get your questions answered and your curiosity cured. Today, with the imminent end of 2015 and the beginning of 2016, the thing on a lot of people's brains, especially if you deal with health conditions yourself, or if you have a family that you take care of, and if your kids are like mine and they like to share germs with kids at school or daycare, then you got to think about the health insurance, because you're probably seeing doctors. Or if you've got little bitty babies, then they have regular checkups, so then you still see doctors anyway. So we're going to go over some terminology today related to health insurance. Health insurance being the thing that you pay for so that when you need health care, whether it's from a doctor or prescriptions from a pharmacy or care at a hospital, they help pay for the costs that build up from the things that they do to take care of you, because the things that they do to take care of you is not cheap, and therefore they have to charge for their services, and so the insurance helps cover those prices. The first thing that the first dollars that are probably going to come out of your pocket for insurance is going to be called the premium. The premium is your dues paying in to be in the club. So I may not need services right now, but the premium is what you pay for the potential need of services. So I'm not currently sick, but if during this month I get sick, then I want to make sure that the insurance is going to be able to cover what I need if I get sick or if I get hurt. So I pay the premium, and that holds my spot essentially to say, here's the premium for this month. If I get sick, then your return on that premium is to pay for the cost that I need to take care of me and make me better. So premiums are usually paid every month. If you get health insurance as a benefit from your employer, then your premiums probably come out of your paycheck. That's the way mine does. I get 2 paychecks a month, so I get a little bit of premium out of one and I get a little bit of premium out of the other one. It comes out of my check before the taxes are taken out of my check, so then the taxes, there's not as much to be taxed on. Kind of a benefit there. But the premium is kind of paying and holding your spot to say, if I get sick this month, then you're going to return on that investment and pay for my care. Now, that sounds nice, and you can't predict when you're going to get sick, and you can't predict when you're going to get hurt, so you can't really pick and choose when you pay your premiums. You just kind of have to pay them all, and if you go a month or several months without getting sick, then they got your money and you didn't get anything back. The flip side to that is, if you get really hurt or you get really sick, then the money that they're paying those healthcare providers to take care of you are going to be way more than the premiums that you paid in. So if you actually need the insurance, you're getting the better deal. So that's how premiums are. Premium is like holding your spot so that if something does happen to you, then they have an obligation to take care of those costs that build up while you're getting better. So then the second thing that will probably come out of your pocket is one of two things. One is a deductible. The deductible is the way that insurances keep your premiums low. So if you want a low premium, then you may have a high deductible. So it's kind of a trade-off. If I'm relatively healthy and relatively safe and wise in the decisions that I make, so I don't get sick and I don't get hurt, then if something minor happens, like a sinus infection, and I have to go to the urgent care and pay a $75 copay, and then I pay $15 for my medication, okay, you've paid less than $100, then it may not be worth paying the insurance $50, $60, $70, $175, $200 a month for them to then cover $85 of your cost. You save money by just paying the $85 out of your pocket and not worrying about having the insurance pay for that. So sometimes the deductible may be you have to pay $1,000 out of pocket before the insurance will pay. Other times it's a lot higher. You can have, if you have a higher deductible, then your premiums are probably going to be lower, because that means the insurance isn't going to have to be paying attention and taking care of you until you reach a higher limit. So sometimes you may have a deductible of $5,000. You would pay $5,000 out of pocket before the insurance started picking up those costs. But sometimes people can budget and say, I probably have a $5,000 cushion throughout my whole year to be able to pay for healthcare costs. So then you can probably have a lower premium where you're only paying them $30 or $50 a month versus several hundred. So that's the trade-off. You want a low premium, you end up with a higher deductible, and then all of that money for the deductible is coming out of your pocket versus all of the premium money coming out of your pocket and you having a low or zero deductible and the insurance starts paying right out the gate. Two of the quickest ways to get rid of your deductible, like to get your deductible done and gone: have surgery, have a baby. I don't necessarily recommend them unless it's like something that really needs to happen or something you really want to do, like having a baby. But those are two things that stack up healthcare costs really fast in a really short amount of time, and like then your deductible's clear. So then talking about copays, copays are essentially that. If you break the word down, together, so like co-op, meaning working together, pay, payments. So it's what you're paying together with your insurance. So the insurance pays part and then you pay part. So you're paying the total bill together. So for doctor's visits, Steve said he had a $12 copay. Oh my goodness, that's a really cheap copay for a doctor visit. There's also copays on prescription medication. So the insurance says we'll pay a little part of the medicine and you're going to pay a little part of the medicine. So for the total cost of the medicine will be covered together. And they try to make that as standard as possible. Copays are usually standardized, like doctor's visits, $12, specialist visits, $25. And so you have a copay but no deductible. So that probably means that your premium, you're paying a little more to make sure that they're covering all of that better. Prescription copays, $5 for generics, $40 for brand names. You pay every quarter. Okay, so yeah, so you can pay some insurances, depending on if it's through your employer, however they design it and make the deals with those things. You can pay your healthcare premiums just about anyway, just like you pay like your car insurance premiums or your home insurance premiums, where you can pay biannually or you can pay quarterly, and you kind of like put the chunk of money there and it's done, and then you're taken care of for that whole window, and then the next one comes around. Okay, TRICARE. Yeah, that's insurance through the DOD is completely different, and because it's kind of government run, they have their own set of rules. Kind of like Medicare has its own set of rules, and I could probably go over that, but I don't think very many Medicare recipients are on Periscope. If they are, then like we can talk about it. But this is just like straight up commercial insurance, whether you have to insure yourself through the Obamacare exchange or getting benefits and health insurance benefits from your employer. These are kind of the terms that get thrown around that you have to decide how you want to spend your money on insurance and how you think they can best cover you and the state of your health for you as an individual. The other word that goes along with how you and your insurance share payments on different services is called co-insurance. And that's kind of tricky. But co-insurance is essentially calculated on a percentage. So where copays are like a standardized, and you hear things about, especially in prescriptions, things are in tiers. So tier 1 has a particular price. Tier 2 has a particular price. And so it doesn't really fluctuate much in between. Co-insurance is strictly based on percentages. So insurance will say, I will pay 80% of your ER visit, and then you have to pay the other 20%. So if your ER visit is for a broken arm, then the total price of that may be different than if your ER visit is because you had a heart attack. So the co-insurance is a percentage. So the percentage is set, but when you calculate the percentage of each individual thing that you might need, then the price varies of what's going to come out of your pocket. In insurance speak and literature and things like that, your out-of-pocket, they actually calculate that. And they keep track of what you've paid out of pocket. It may be abbreviated OOP for out of pocket. Out of pocket. And that's money that's actually coming out of your pocket, out of your wallet to pay either the insurance or pay the doctors or hospitals or pharmacies for the services that the insurance didn't cover, the portions they didn't cover. And insurances will usually give you a lifetime maximum, or they call it a lifetime limit, and they add up your out-of-pocket so that if you reach that limit for like something catastrophic, like a bad accident that led to multiple surgeries that then led to multiple doctor's visits and then physical therapy and recovery and all of that, something really tragic and disastrous like that. If you reach that out-of-pocket limit, then the insurance says, okay, you reached the limit, we're taking care of everything else 100% until it starts over. So sometimes it's like an annual limit, other times it's like a lifetime limit. So if you have the same insurance for multiple years and they add that up, and when you reach that limit, then they're like, all right, we're taking care of everything, it doesn't matter. So that is kind of good, kind of an incentive to stick with the same insurance company the whole time. Again, the other things when it comes to deductible negotiations or premium prices and things like that can determine if you stay with the same insurance company or change. So then a couple of words that probably come up more for me in the pharmacy, words like formulary. The formulary is essentially the nice little defined box of medications that the insurance will pay for, and if the doctor writes a medication that's not in their little box, then they won't pay for it. So formularies generally include all generics. Formularies include brand names in classes that don't have a generic. But even then, sometimes they get to pick and choose, and they'll say, okay, we'll choose this brand name over this other one, and so then the doctor has to write you prescriptions if you're going to be using those medications. So the formulary is their little box to limit, because there's like tens of thousands of prescription medications out there. So instead of them paying for every single one of them, which isn't financially wise on their part, they say, okay, we're going to pick and choose a few from each class for every treatment option out there, and then that's going to be the ones in their little box that they're going to pay for. Another word or another term that we use a lot is prior authorization, which means that it needs to be authorized prior to the insurance paying for it. Okay, we can kind of break that down to make that make sense. So if it's a medication not in their little box, then it requires to be authorized by documentation or proof of something from the doctor's office for the insurance to say, okay, yeah, we understand why that's the best medicine for you, so now, yeah, we're going to choose to pay for it. So sometimes doctors' offices have to prove to say, hey, she's tried 5 other medications on your formulary and they all haven't worked. So now we need this 6th one that's not on your formulary because we think it's going to work. And so then the insurance will choose to pay for it. Sometimes certain procedures require to be authorized prior to the insurance agreeing to pay for it. If you need a particular test from a specialist or a particular procedure from a specialist because they're trying to either figure out what's wrong with you because you've been sick for a long time, or they know what's wrong with you and they have to do this very specialized thing. Sometimes those procedures require that authorization before the insurance will agree to pay. So prior authorizations are done a lot. Staff at doctors' offices know that process because they have to do that a lot. We at the pharmacy know the process to get the doctor's offices started on that because we really do deal with that a whole lot. And Insurance has changed their formula. They're changed their mind. They'll be like, okay, it's 2015. We'll pay for this one thing. And then 2016 will roll around and they'll have changed their mind. And they want to pay for something different, or they just want to knock that particular one off their list altogether. So prior authorizations are things that are very common in our healthcare realm to make sure that the insurance is paying for the things that the doctor wants patients to take. In the same vein as the formulary, insurances also have networks. And the network, you'll hear about like an in-network provider or an out-of-network provider, and they have different rules of how they pay each one. Some insurances won't pay out-of-network providers, period. Sometimes they pay just less, and then that makes you have to pay more. Providers that are in networks, it can be pharmacies that are in the network, it could be doctor's offices or hospitals or clinics that are in the network. It just means that they've kind of come to a negotiation table to say, okay, we'll pay you a little bit more as long as you promise not to like jack the prices up too high on us. And so there's some negotiation of how certain services are reimbursed between the insurance company and the provider of the services. And so you're going to get lower copays, and then the insurance you're not going to cost the insurance as much money if you see an in-network provider or go to an in-network pharmacy. You know, you probably don't care how much money the insurance is spending, but you care about how much money you're spending. So if using an in-network provider saves you money, then that's going to be the important part. And then 3 other abbreviations, and this will be the last ones: HSA, HRA, and FSA. HSA is a health savings account where you put money in to say, here's some money that I might need to use specifically for health care cost. So you put the money in the account. As you accumulate healthcare costs, whether it's copays for prescriptions or copays for doctor's visits or a hospital bill or whatever, then you use that money in that account to pay those bills. So that requires you to kind of do some guessing and some estimating and some like forward prediction to say, this may be what I might need. So again, if you already are in the plan of having a baby, then putting aside some money in an HSA allows you to then have money to pay for those costs once the baby's born. Then there's an HRA, that's a health reimbursement account, and some employers and health insurance companies provide this. So you do certain things that is in the vein of like preventative medicine, so getting your vaccines, doing a health screening where they test your cholesterol and your blood sugar and your blood pressure and things like that to kind of give you a snapshot picture of what your health is currently in those main areas that seem to affect lots and lots of people. Doing those things, reporting those numbers to your insurance, then the insurance or your employer will then give you money to use towards healthcare costs. So you do this test, you report your things, you answer these questions about whether you smoke and your tobacco use and your alcohol use and like your risk of getting depression or something like that. And then they will put money in an account for you. And then you can use that money, again, to pay for copays of prescriptions or to pay copays at doctor's office or other health costs that have accumulated for different things you've needed for treatment. So rather than it being your money that you're saving, that's an HSA, this is money that you're being reimbursed for trying to prevent disease and sickness in your life. So your insurance or employer is reimbursing you for making good decisions. Okay? Cool. And then there's the FSA, and that's the flex spending. And again, that is money, that is your money that you're putting into an account. Flex spending usually will you kind of accumulate it during the year, but it has an expiration date. HSAs usually roll over. HRAs usually roll over. FSAs do not roll over. So again, you have to do some forward-thinking prediction of, this is what I think some healthcare costs that I might accumulate, so we're going to set this money aside and save it for those costs. But if that money is not used, even though it was your money, if that money is not used by the deadline, when they say your FSA money expires on X date, which is usually December 31st for a lot of people. Some have like an extension and it'll be like March 31st into the next year, and then that money goes away. But that money has a little bit more flexibility, that it's a flex spending, because there are certain approved over-the-counter things that you can use that money on, where your HRA and your HSA cannot be used on over-the-counter things. And the flex spending over-the-counter approval has been narrowed a lot. It used to be like any over-the-counter medicine kind of thing, so like first aid supplies or pain relievers or vitamins or things like that. They've kind of narrowed it down a little more. But in most pharmacies like Walgreens, CVS, Rite Aid, things are going to be labeled as FSA approved, and when they scan it at the cash register, it'll have an FSA code that's to say this is FSA approved. FSA is also the one that you usually have to submit receipts for more often to prove that you're using that money on approved items, whether it's prescription copays, which are always approved, doctor's office copays, hospital bills, those kinds of things. But if you're making over-the-counter purchases, then they do ask for receipts. So then you have to submit those in the right amount of time. So that's kind of crash course on health insurance and things that are going to be popping up. And probably if you haven't already gone through a selection process, some places call it open enrollment, because it's like the windows open and you can now choose another health insurance if you want to, or then choose to stay with the same one to make sure that you're enrolled in some type of health insurance plan. For some, that's already passed. For some, that's still going on. But 2016 is going to be a new year, and there's going to be some new things going on. People's deductibles reset, copay tiers change, formularies change, those kinds of things. Sometimes prior authorizations expire, so something was approved for 2015, and if you still need it in 2016, the doctor has to get it reapproved. So for a lot of people who are dealing with health conditions for themselves or health conditions for their kids, those are going to be things in the front of their brain. So crash course, health insurance, and all the terminology that can be used. If there's other terms that pop up in specific plans or in a specific situation for you, you can always tweet me your question, or you can ask your question on my Facebook page, which for my podcast, facebook.com/farm, PHARM, Farm Answers Pod. Then my podcast is Pharmacist Answers on iTunes. So you can hear some other health topics that I've talked about there. And I hope y'all have a great Monday. Bye.
Thanks for listening to the Pharmacist Answers podcast. The pharmacy is now closed. You can post your questions and comments on our Facebook page. That's facebook.com/pharmanswerspod. Or you can email the show at pharmacistanswershere@gmail.com. You can tweet me or message me on Twitter @SinHendrix. You can find the show notes at pharmacistanswershere.wordpress.com. Pharmacist Answers broadcasts live on Monday, Wednesday, and Thursday at 9:02 a.m. Eastern Time on the Periscope app. You can follow me @SinHendrix or view in your web browser at periscope.tv/SinHendrix. See you next time on the Pharmacist Answers podcast.